consumption of unhealthy foods, alcohol, tobacco, and environmental pollution are attributed to non-communicable diseases, which now accounts for over 40% of deaths. These are usually driven by industry influences, also known as the commercial determinants of health in sub-Saharan Africa. The trend is a public health concern. The Addressing Commercial Determinants of Health in Sub-Saharan Africa, ACORDS, is a project which will from 2024 to 2028 explore how commercial actors shape health outcomes in Ghana, South Africa, and Kenya. It aims to co-create research and policy strategies with government and civil society to mitigate the health impacts of unhealthy commodity industries.
Communicable diseases such as hypertension, cancer, and diabetes account for over 43% of all deaths, with the World Health Organization warning that the burden is rapidly rising in lower and middle-income countries. Research has linked much of this health crisis to commercial industries' aggressive marketing of alcohol, ultra-processed foods, sugar-sweetened beverages, and tobacco products, now more accessible than fruits and vegetables in some communities. Ghana is estimated to lose over $300 million annually in productivity due to NCD-related illnesses. The ACORDS initiative, backed by the UK's National Institute for Health Research, involving partners from Ghana, Kenya, South Africa, and the United Kingdom, aims to shift the narrative by placing commercial accountability at the heart of public health interventions. The dissemination event held in Accra brought together researchers, health professionals, and policy advocates. They warned that Ghana is facing a public health crisis fueled by ultra-processed foods, alcohol, sugar-sweetened beverages, and fossil fuels. A professor of public health at the University of Allied Sciences, Professor Francis Zotto, revealed the commercial interest behind these products, which have been found to have a profound impact on populations in Ghana and across sub-Saharan Africa. He called for urgent regulation on advertisements, pricing, and labeling of unhealthy commodities.
Today, unhealthy commodities such as tobacco products, alcohol, beverages, the sugar-sweetened beverages, the ultra-processed foods, the salty foods, high fat, high salt, high sugar. These are really affecting us. When we talk about the trans fatty acids, and these are aggressively marketed, even to our children in our communities.
The lead investigator, Professor Jeff Collins from the University of Edinburgh, emphasized that the project is the first of its kind to systematically tackle commercial health determinants in sub-Saharan Africa. He said businesses often prioritize profit over public health, and unless regulated, the activities will continue to threaten sustainable development. The executive director of the Vision for Accelerated Sustainable Development and convener of the NCD Alliance, Mr. Labran Musa, called on government to limit industry interference in public health policy making.
We are calling on policymakers, especially with the Mama Care, for instance, that the funding gap is so huge. We should find a way to limit the extent to which industry would interfere or industry would get involved in supporting, this whole process.
The ACORDS initiative, which spans 2024 to 2028, will explore how commercial actors shape health outcomes in Ghana, South Africa, and Kenya. It aims to co-create research and policy strategies with government and civil society to mitigate the health impact of unhealthy commodities.